I would encourage everybody to use ePMA across the NHS.
We've got a completely clear record that is legible, accessible, and gives me all the information that as a manager or as a clinician that we need to know about that patient's medical history.
If everyone is using EPR or everyone's using one system, then that's going to improve efficiency.
You have to be engaged with the process. It's not as daunting as you're expecting it to be when you get round to using it, but you've got to be engaged with that process. You've got to have the structure within the ward, and you've got to have the support of everybody within that ward to make it work.
The environment that we're in, we can't stop what we're doing to implement the change. We have to keep moving and keep going and maintain patient safety in the service that we give. With the old system, there's so much duplication of work, sort of writing out lists of drugs, for example. The doctor writes out a list of drugs when the patient's admitted to hospital. They then copy that list onto a drug chart. We, as pharmacists, then come along and recopy out the list as an order sheet. A technician may then copy the list onto a computer to generate labels, for example. So it's a lot of transcribing of drugs, whereas in an electronic system, you can just do that process once, and then the electronic order can be pulled through to various different places.
And my best advice is to engage in the ePMA core group early on. The people I mean that need to be engaged are everyone from each team, so a multidisciplinary approach, nurses, medics, surgeons, physiotherapists. Everyone should engage early on.
There's probably millions of different things that can go wrong with paper-based systems. One is legibility of the medication. Two is the process of prescribing, meaning that eventually you have to rewrite the drug chart. And then something else that when you're down in clinic and you want to see what someone was on, it's good if you've got the notes there, and it's good if the drug chart's filed, but often it isn't. Often you won't necessarily have the drug chart sent down. But with EPR you can access it from wherever you are.
I think when you reflect, now that we've got an electronic system, you do realise the problems we had with paper charts. There's been many times I've picked up a paper chart and I couldn't actually read the prescription, which has actually gone on to cause delay in the delivery of that medicine. With the ePMA system, there's no room for error in legibility, and obviously it will prompt prescribers to actually complete their prescriptions in full.
There's always a sort of gut reaction to any change, which is unjustified and out of proportion. People who were sceptical of it initially are probably now using it quite happily. And you realise how easy it is. You know, I can write drugs up from my office rather than being on the ward if necessary. Then people like it and they'll get on with it.
It takes a good few days, probably 2 to 3 weeks of using the system day in, day out, to move from being a new system that is daunting. It is different. It's a very massive change in nursing practice, to just being part of your everyday practice. Having the super users and having ownership within the ward was key. I think staff need to engage with the process, because that's the only way it does work, is when staff do everything that they can to get the process working together as a team. And as a team, you will overcome any problems that you're faced by using ePMA.
It was still quite a steep learning curve once we went live. Things crop up still now that we think, oh, actually, you know, we maybe haven't thought of that in the best way, and we can adapt what we're doing. The training just really gives you a basic understanding of the system, and then once you go live, then it's working with your colleagues to learn how you're going to use that system in your area.
I think that a lot of us thought you could either just moan about this and complain about this, or get on with it. And I think it was just trying to instill in everyone, look, this is going to happen, it will be better in the long run. And absolutely the best thing to do, after the initial training, which is online or classroom, you've then got to have someone sitting with you who shows you and watches you and really just lets you make mistakes on the system. You're going to find that there's a very big, steep learning curve initially, and the best thing to do is just to climb the learning curve as quickly as you can with hands-on experience.
You can't really get it wrong. The system won't allow you to. So if you have any trepidations about using it and not being able to be competent in it, just use it, and you won't get anything, it won't let you do anything wrong, so don't be frightened of it. And I think once you feel comfortable with it, you'll realise it's an asset.
The time that I felt that was really going to be benefit was when I spoke to the team on our triage unit, and they were just using it, and they were people I'd worked with for years, some of them, and they just said no, it was fine. So I think it was just the reassurance from people who are using it that it was going to be okay. I know that especially out of hours, it's a big advantage for junior medical staff if they need to prescribe, for instance, paracetamol for a patient who's on the other side of the hospital. In the old days of paper chart, you had to physically go and write it down. Now you can access the records electronically, prescribe it, and the patient can receive their paracetamol or whatever painkiller you're going to use straight away.
The biggest advantage of the electronic system is patient safety, being able to read clearly what's been prescribed by a doctor. We don't want to, move away from being at the end of a patient's bed, and there's no substitute for that. But there are instances when you may need to find out what's going on with your patient when you're not able to be at the bedside. Now we can log on, look at our patient list, and you can easily identify who are the new patients, who the patient's going home. In the past, you'd maybe start at bed 1 and work to bed 30, and bed 29 might have 5 new drugs that you don't see till the end of the day, whereas now we can immediately see who's been prescribed something new, prioritise those patients, and work through in a logical order.
Advantage 1 for ePMA, for the use of electronic resource, for me would be the access to my scope of medicines that I use. Advantage 2 would be having all the information on one screen. Advantage 3 would be the presence of the scanning hardware to actually identify the correct patient for the correct medicines. The scanners work really well. It's really important to identify your patient and make sure the right medicines are given to the right person.
The PPID system, I think, is a real advantage for patient safety. The nurses scan the patient and the drug chart will appear, and any medicines that are due for the patient appear on the screen. So then the nurse just is then cross-referencing the drug to the prescription, and they know that that's the correct patient that they're giving the medication to.
I think the flexibility of the system allows you to access patients' records pretty much anywhere, and if necessary I can change things or reorder things remotely, as it were. So that's a great benefit, I think. It's all a much safer and much more accountable process now.
In the longer run, we're going to have fantastic access to data. It's going to help us make things much better in the future by understanding what we're doing at the moment. Whilst we were stuck in the paper age, we're never going to be able to do that.
I feel ePMA helps me look after the patient a lot better because I'm able to prescribe medicines more efficiently and safely, and then actually go and administer that using the PPID system to actually identify the right patient. So if patient safety is improved, patient care is improved.